Good afternoon, dear audience, dear colleagues. I'm Adrienn Kovács from the Department of Internal Medicine and Hematology, and my PhD topic is about ketosis-prone type 2 diabetes. My mission is to increase awareness about this type of diabetes and also to decrease the unnecessary insulin administration that often happens during the therapy of ketosis-prone type 2 diabetes. I have two projects. The first one is about describing the clinical characteristics of this type of diabetes, and the second one is registry analysis of Hungarian patients with ketosis-onset diabetes. About my first project, just a few words about the background. The major question when a patient shows up in our office is to decide whether the new-onset diabetes with ketosis at onset, is it caused by type 1 or rather by ketosis-prone type 2 diabetes. Ketosis-prone type 2 diabetes is now a separate form of diabetes. It is in the hybrid forms of diabetes. It was announced by the WHO 3 years ago. And what we should know about this type of disease, that it presents with unprovoked ketosis onset. Patients have preserved beta cell function, which is measured by the C-peptide level, and they also lack diabetes-related autoantibodies. A significant number of these patients do not need insulin in the long term after the ketosis phase is resolved. Since this is a new entity, we have so it is incompletely characterized. So that's why we think that awareness increase is needed. And also, a proper classification will facilitate a proper long-term treatment for the patients. So just a quick reminder about the results. We have found that patients with ketosis-prone type 2 diabetes are significantly older and have a higher BMI compared to type 1 diabetes. And this first project was submitted to the fourth journal this week, and now we are waiting for a hopefully positive response. I will continue with the second topic. This is a cohort analysis, and it follows. It was a long-term follow-up of Hungarian patients with new-onset diabetic ketosis. About the background, we have very few data concerning ketosis-prone type 2 diabetes patients of Caucasian ancestry. So our center will be the first to present data on ketosis-prone type 2 diabetes in Hungary, and it will be among the few other Caucasian population projects. We had two aims with this project. The first one is to describe the prevalence of ketosis-prone type 2 diabetes, and the second aim is to compare this entity to autoimmune type 1 and non-ketotic type 2 diabetes. Here you can see our study design. So we had almost 200 patients with new-onset diabetes, and based on the clinical features, which means that the presence of ketosis, presence of autoimmunity markers, and beta cell function, we categorize the patients into these four groups that you can see. Type 1 diabetes is the autoimmune positive and low C-peptide level type of diabetes with ketosis. The type 2 diabetes is, or patients lack autoimmunity markers but have a preserved beta cell function, and there is no ketosis in this type of diabetes. Type 3 diabetes is known also as LADA, the latent autoimmune diabetes, with autoimmune markers but without ketosis. And our main interest is this group, the fourth group, ketosis-prone type 2 diabetes, where patients have no autoantibodies, but they have a preserved beta cell function, and they present with ketosis. I will show you a few plots. These are the descriptive statistics. Here you can see the BMI of the patients in the four groups. This is just for descriptive purposes, so we cannot compare the groups, but if we look at the type 4 group, we can see that the median is about 30. So these are, they were obese patients. I will continue with the hepatic steatosis index. Here you can see how it is calculated, and it shows the rate of hepatic steatosis, the fatty liver disease. And our group of interest had a high rate of hepatic steatosis. Here you can see the age of the groups. These patients with type 4 diabetes or ketosis-prone diabetes, their median age is around 50. This is, these are the comparative data between the groups. Here you can see by this with this black mark, it is for the means, and this gray area is the confidence interval, and if the red arrows overlapping, it means that there is no significant difference between the groups. If they do not overlap, then it means that there is a significant difference. I would highlight the comparison between type 1 and type 4. As I said, this is the main clinical question. This is what we should differentiate. And we can see that the BMI is significantly higher in the ketosis-prone group compared to type 1 group, and also the hepatic steatosis index, the rate of hepatic steatosis, the presence of, which means the presence of fatty liver disease. It is also significantly higher compared to type 1 diabetes. These results were adjusted for age and sex also. And actually these results are the same as we saw after we have done our meta-analysis. In summary, we can say that this study reports on a relatively high number of patients from the Caucasian population with ketosis-prone type 2 diabetes. But of course, there are limitations. So this is a retrospective data collection and only a single-center study. And we were able to measure only 2 types of autoantibodies. Now we are about to finalize the plots and the results, and then I will work on the manuscript. I will close the presentation with this quote: "Absence of evidence is not evidence of absence." Thank you for your attention.
Questions. I have got one for you. What is the incidence trend of ketosis-prone diabetes? So is it getting more common? Is it truly getting more common, or are we just realizing more patients have this type of ketosis?
Yes, we believe that there is a strong correlation with obesity and with the growing incidence of fatty liver disease. So definitely there is a growing number of new diagnoses of ketosis-prone type 2 diabetes, but also the reason for this can also be that it is now better diagnosed and
So the interesting question goes then, is it proportional? Is it directly associated? Is it a certain number of obese type 2 diabetics who get the ketosis-prone diabetes, or is it increasing more than the obesity and then type 2 diabetes' incidence and prevalence? Are we expecting a far greater proportion of patients in the future than we see now among the type 2 diabetics? That's the easier way to ask.
Yes, we think the number will still grow, but since we don't know the exact pathomechanism behind this disease, it's hard to predict how big proportion of type 2 diabetes will end up diagnosed as ketosis-prone type 2 diabetes.
Thank you. Orgi. And then Stefania.
Thank you, it was excellent. Just a quick question. What's the next step? Where are you off to?
You mean with the second project?
Yeah, with the project, because now we have like data on 22 patients.
Yes.
What's the next step to explore?
Actually, we are planning to establish a registry, so we could collect prospective data also, and we also plan to work together with the Department of Pediatrics. So hopefully we will have data on adult and the pediatric population also.
Great talk, Adri. How do you think we should approach the diagnosis of patients who come with ketosis at onset? Do you have like an algorithm that you want to propose? And is this the test that you want to do? Are they covered by the insurance, by the regular insurance for the patients? Mm-hmm. Should we select some of the patients whom to test so that we don't spend all our resources, or what do you propose?
Yes, thank you for the question. So there is an existing algorithm in the literature. So every new patient presenting with ketosis should undergo autoantibody and C-peptide measurement. This is not a new thing, but unfortunately it is covered by the insurance in Hungary, but these types of tests are only available in the centers like our university, but not in other regional hospitals. So these patients should be sent to the centers like ours.
Thank you.